Hi, my name is Brittany Corso, and I'm going to be doing your eyes and ears assessment. Let me wash my hands before we get started. To whom do I have the pleasure of meeting and assessing today?
My name's Colin Corso.
Oh, what a pleasure. So happy to have you here, Mr. Corso. All right, are you doing okay today?
I'm doing great.
Okay, wonderful. So we're going to get started on our assessment. The first thing we do with every assessment is we start by inspection. So I am going to first, if you can just look forward for me, Mr. Corso, I'm going to first inspect his eyebrows. So I'm looking for symmetry. I'm looking at both eyebrows. Can you raise them for me? So they move symmetrically. I'm looking at the hair distribution, making sure that the growth is nice and evenly distributed throughout, which I do see. I don't see any scaling, lesions, or excessive dryness. So we do look great there. I'm gonna move on to his eyelids. So can you close your eyes, please? Beautiful, open. So I'm looking that he has complete closure of the lids. If he does have incomplete closure, that would warrant me to assess for a corneal abrasion. I don't see that here. They close symmetrically and bilaterally, so that is a positive sign. I'm also looking for lid lag. So I'm making sure that I see, when I'm assessing, that I see, that I don't see, the white, the sclera on top of the iris. If I would see that, that could indicate hyperthyroidism and that would warrant further assessment. I do not see that here, so that is a good sign. I also don't see anything asymmetrical. So they both symmetrically look the same and like they rest evenly above both irises. I'm looking next at the eyelash distribution and that growth. I don't see any scaling, lesions, or abnormal hair growth pattern. It looks like the eyelashes are growing nice and evenly throughout. Very beautiful. So next I'm gonna move on to assess the lens and the cornea. So I'm gonna get my light here and I'm going to shine it on this lateral portion of the eye. I don't see any opaqueness or any cloudiness. It does look nice and rounded throughout. So then I'm gonna come on the other side to assess this eye. Same thing. Looks very nice and rounded. I don't see any opaqueness or cloudiness. So we do look great there. His eyes, assessing the actual eyeball, they don't look like they're protruding out or they're sunken in. They do look symmetrical and evenly placed on his face. And they do look nice, glossy, and rounded. I don't see excessive tearing of the lacrimal gland or excessive dryness. It does look appropriately moisturized. So I am going to continue on to assess his pupils and the iris. So I'm looking at the iris first. The iris has an even color distribution throughout on both eyes. Also, the pupils do look equally round and symmetrical. Although it can be a normal finding for one of them to be asymmetrical, it can indicate a brain lesion or a central nervous system defect. So when I'm looking at his pupils, they do look equal and nice and round. So what I'm going to do first is I am going to place a light here. If you can just keep looking forward, Mr. Corso. I'm going to place a light here. I'm going to dim the lights about 12 inches away. And then I'm looking at the corneal light reflex. So what I'm assessing for is bilaterally in both eyes. I want to see the white reflection of light at the same area on the eyeball on both eyes, which I do see. If I see that the white reflection is different on either eye, that can indicate asymmetry and that does warrant further assessment. So next I'm going to do the pupillary reflex, light reflex. So I'm going to ask that you continue to look forward, Mr. Corso. And I'm going to shine my light into his left pupil first. And what I'm doing is I'm assessing that this pupil where I put the light constricts. And now I'm going to do it again on this eye, but looking at the right eye. And I'm ensuring that that pupil also constricts bilaterally at the same time in the opposite eye. So next I'm going to assess the opposite eye. So I'm going to do his right eye. I'm looking at the right eye and ensuring that I see constriction when I shine the light into his pupil. Beautiful. Now I'm looking at the left eye. And I do see constriction, bilateral, and symmetrical. So that is a great sign. Next, I'm going to test for accommodation. So I'm going to ask that you focus on an object far away in the distance. Straight. Okay, now look at my finger here. Now look again away at the distant object. Perfect. So what I'm looking at in his pupils is that when he focuses on an object far away, that I have a dilation of the pupils bilaterally. And then as he focuses on my fingertip or the object that's about within 12 inches of range, I want to see pupillary constriction bilaterally and symmetrically, which I did see. And that's great. So next I am going to assess the eyeball again with my light, and I'm looking at the ocular fundus. So when I shine my pin light into his eye, it may cause some watering, and that is normal. So I am going to get pretty close to his eye, and I'm looking in the pupil. So I'm looking at 4 different aspects when I'm looking at the ocular fundus. So the first thing I'm going to look for is the optic disc. So the optic disc is usually located on the nasal side, closer to the nasal side of where I'm inspecting. And it's usually like a creamy yellowish orangish color. Usually the borders are well defined, but it may be a little more blurry on the nasal side, and that can be normal. I'm looking at the shape of it, that it's nice and rounded. Any other shapes are worth noting, or any abnormalities in color. I am also noting the retinal vessels. So I want to ensure that the retinal vessels extend to all 4 quadrants. The arteries are usually a little bit darker than the veins, and we may have some overlapping of the vessels, and there may be some torsion. As long as they're not overly twisted, this can be normal. If we do see some twisting of the vessels and it's bilateral, we can suspect that that is a normal finding. Also, I want to ensure that I don't see any pulsations in the vessels. And I'm going to then move on to assess the general background. So the general background should be kind of like a light pink to a darkish reddish brownish color. And it should be even throughout. If I see any discoloration, so if it's like opaque or blue, or if I have any obstructions in the general background, that can warrant further evaluation. Lastly, I'm going to assess the macula. So the macula is more on the lateral portion of where I'm inspecting. And the macula is typically a shade darker than the general background, also kind of rounded in shape. And if I see any abnormal consistency, if I see any abnormalities either in shape or in color, then that is worth noting as well. So I am going to move on to the next portion of the eye exam, and that is to inspect the sclera and the conjunctiva. So is it okay if I put my hands on your face, Mr. Corso?
Sure.
Okay, wonderful. So I'm going to gently, if you can open your eyes, please. I'm going to lower the eyelids. I'm looking at the sclera throughout. It does look nice and white, and I do see even distribution of like light pink to reddish blood vessels throughout. It looks nice. If I would see any discolorations on the sclera, that is worth noting. If I would suspect jaundice, it's usually a nice and yellowish color even throughout the sclera, and that goes the same with the conjunctiva. So normally when I inspect the conjunctiva, I should see it to be nice and pink. It is normal to see maybe a little bit of pallor on the medial side, but it should be nice and pink throughout. If I see some paleness throughout the lateral portion of the conjunctiva, that can indicate anemia, so that is worth noting. And then if I see any yellowish and even yellowish color of the conjunctiva, that can also indicate jaundice. If I see any excessively white or blue like cyanosis color, then that is also worth noting. So I'm going to palpate here on the lacrimal gland, and I'm ensuring that, do you feel any pain when I touch?
No.
That he doesn't feel any pain, and I don't see any excessive watering whenever I do palpate that area. So we're looking pretty good. Next, I am going to assess his ears. So we're going to move on to the next portion of the exam. So I'm looking at the ears on each side, and first I'm checking for symmetry. They do look like they're placed at about the same part of his head bilaterally. They do look symmetrical in size and in shape. They don't look excessively large or excessively small. I don't see any scaling, lesions, excessive dryness. Do you feel any discomfort or pain when I touch?
No.
Okay, wonderful. So then I'm going to come here and I'm accessing the auditory meatus, and I'm ensuring that I don't see any crusting, any lesions, any bleeding, or any foreign objects in our opening, the auditory meatus. So I'm going to pull the pin up and back so I can assess the tympanic membrane. So I'm going to put my otoscope in his ear, and I'm assessing the tympanic membrane to make sure that it's a nice pearly gray color throughout. On the right ear, I should see a reflection of the white light on the tympanic membrane at about the 5 o'clock portion. If I see that light reflex at any other part of the ear, or if I see any yellowing or redness on the tympanic membrane, that is an abnormal finding. So I'm going to do the same on the opposite ear, except the white reflex in light should be at about the 7 o'clock portion on the tympanic membrane. Okay, very good. And you said no pain whenever I touch your ears, right?
Nope.
Okay, excellent. So next, the last portion of our exam is going to be the whisper test. So I'm going to ask Mr. Corso to please press on this part of your ear, the tragus. I want you to occlude one part. Perfect. Just so where we can only hear on one ear. So I'm going to repeat a letter and number combination, and I want you to repeat it back to me, okay?
Okay.
So within like 2 feet or an arm distance apart, I'm going to start the whisper test.
K3P 492 CX4.
Okay, wonderful. So if he gets 4 of the 6 number letter combinations correct, then that would indicate a passing exam. So next we're going to do the other ear.
X59 CD4 1KX KX.
Okay, wonderful. So he sure did pass that hearing test. It was wonderful assessing you today, Mr. Corso, and I do hope to see you again in clinic. Thank you so much.
Thank you.